Hello. Schizophrenia is a serious, lifelong mental health condition affecting 1 in 100 people. Schizophrenia is a type of psychosis and affects the way a person thinks, feels, and behaves. People with schizophrenia are 2 to 3 times more likely to die early than the general population, and this is often due to preventable diseases such as heart disease, infections, and metabolic syndrome. Metabolic syndrome is a group of conditions that increase a person's risk of heart disease, stroke, and diabetes, and these include high blood lipids, high blood sugar, high blood pressure, and obesity. We do not know the cause of schizophrenia. However, it is widely believed that people may be at increased risk due to their genetic makeup, and then the condition may be triggered by an environmental factor such as stress or drug use. Other risk factors include nutritional problems before birth, exposure to viruses before birth, living in poverty, living in a stressful environment, difference in volumes in specific parts of the brain, and an imbalance in brain neurotransmitters. Schizophrenia occurs equally in men and women. In men, the mean age of onset is 5 years earlier than in women. Its onset is typically in late adolescence or early adulthood, and the age of onset is defined by when people have symptoms specific to schizophrenia. However, there's a prodromal phase between several months and years of non-specific symptoms prior to the onset of the symptoms and signs of schizophrenia. These prodromal symptoms may include depression, anxiety, difficulties in concentrating, changes in thinking and perception, distrust, social withdrawal, lack of enjoyment in activities, and general decline in functioning. The symptoms of schizophrenia generally fall into 3 different categories: positive or psychotic symptoms, negative symptoms, and cognitive symptoms. The positive or psychotic symptoms include delusions, hallucinations, and thought disorder. Now, a delusion is a fixed, false belief that is out of keeping with a person's educational and cultural upbringing, and it is firmly held even when evidence to the contrary is given. Another psychotic or positive symptom is hallucinations, where people may see, hear, smell, taste, or feel something, and it's very real to them, but it does not come from outside of their mind. This could be hearing voices or seeing something that's not there. And the third positive symptom is thought disorder, where the speech can be muddled or disorganised, or new words can be used that are made up. Negative symptoms are where somebody is not functioning at the level they were previously. These include loss of motivation, lack of interest in things that normally would interest them, social withdrawal, difficulty showing emotions, speaking less, a flat affect, that somebody's face doesn't move so much with emotions, to express emotions, difficulty planning and beginning and carrying on and finishing activities, lack of enjoyment in activities, and difficulty functioning normally. Cognitive symptoms include difficulties with memory, attention, and concentration. With some people in schizophrenia, it's difficult to notice these, but with others, these difficulties become more prominent. They may affect somebody's ability to sustain a conversation, remembering appointments, or learning new things. People may experience difficulty processing information to make a decision, difficulty paying attention and focusing, and problems using information immediately after learning it. Treatment for schizophrenia includes antipsychotic medication, psychological treatments such as cognitive behaviour therapy, other treatments such as coping strategies, behavioural skills training, supported employment, and family education and support. Thank you for listening. Bye for now.